Juvenile disease, diabetes. What is diabetes? Diabetes is a chronic disease. It generally occurs when the pancreas does not produce enough insulin. Now, here, insulin is a hormone in our bodies that helps in regulating glucose. Glucose is basically the simplified form of carbohydrates. So, it helps in regulating carbohydrates present in the blood. Now, if the pancreas is not producing enough insulin, or the body is not that able or capable of using the insulin produced by the pancreas effectively, then that condition is said to be diabetes, and the person having diabetes is said to be diabetic. What are the symptoms of diabetes? To understand the symptoms of diabetes, we need to understand the categories of diabetes. There are four categories, four main natural and basic categories: type 1 diabetes, type 2 diabetes, gestational diabetes, and the fourth category, maturity onset diabetes of the young, commonly known as MODY. Now, in this presentation, we'll be covering only type 1 and type 2 diabetes. Some common symptoms of diabetes which occur in all four the categories are lethargy, like you get tired very often, weight loss. Now, weight loss can be of two types: one, natural weight loss which you want, and weight loss which is like immediate. Every day you are losing some or the other kgs in your body or your body mass. Then, smell of a stone, it is like a breath related issue. You can have bad breath, or you can have you can smell things like which are not natural. Nausea, you want to vomit again and again and again, you feel like very dizzy. Abdominal pain related to your stomach, you can, in layman's language, you can say stomach ache. Hyperventilation, blurred vision, means uh, you can say you can have eye cataract, polyuria, etc. Now, after understanding the categories of diabetes and some common symptoms, we move on to type 1 diabetes. What is type 1 diabetes? It is the first and foremost category of diabetes. We can say it is level 1 of diabetes. If you are a diabetic patient, then the starter is type 1. It typically occurs in adolescence, like when you become a teenager, but it can also occur in children and adults, depending upon beta cells of the pancreas are non-functioning. Beta cells are like some harmful cells, which harmful, or we can say good cells. Type 1 diabetes is entirely based on how much beta cells, or commonly known as B cells, of the pancreas are non functioning. If they are functioning, you won't have type 1 diabetes or any condition of diabetes. Now, self care treatment. If you do not want to go to the doctor, you refrain from going to the hospital. You can do what is, you can have a diabetic diet, like less sugars or less carbohydrates. Nutrition counseling, you can ask your elders. If you are a child, you can ask your elders. If you are an adult, you can think, and like according to that you can set your diet. And carbohydrate counting, how much carbohydrate do you consume every day? Medications, if you go to the doctor and the doctor recommends you some medicines, so you can have some injections of insulin as described by the doctor, dietary supplements, etc. Now, which doctor we should go? Endo- Endocrinologist. He or she will entirely deal with your lower abdomen, like the pancreas, the gallbladder, the small intestine, and that all that part. Nutritionist, nutritionist for nutrition counseling. And pediatrician, if you are a child, then pediatrician is most commonly referred. Moving on to type 2 diabetes. You may ask, what is it? It is again a category of diabetes. It is a chronic condition that affects your body processes glucose. It affects the process in which your body is simplifying the carbohydrate you eat, or you ate while consuming your food. It typically occurs in adults depending upon again the beta cell concept of the pancreas. Now, why type 2 diabetes is different from type 1? Because because diabetes is not entirely based on how you what is your sugar consumption or your carbohydrate consumption. It also depends on your pancreas. If your pancreas is not producing enough insulin, you can still have type 2 diabetes straight. Or if your body is resisting insulin, if your body is like refraining from using the pancreatic insulin, still you can have diabetes. Symptoms include thirst, like you want water every second more than usual. Frequent urination, you just like you want to sit in the washroom for the whole day. Increased hunger, if you are like feeling hungry every hour or every 2 hours. Fatigue, you just become unconscious. And blurred vision, your eyes, like you cannot trust your eyes what you are seeing. It is basically a blurred vision is basically a symptom of eye cataract. Now the question arises, how to prevent diabetes. Diabetes is mainly a disease of sugary substances. People believe if you are eating too much sugar, you can have diabetes. It is true, but not always. It is not always the case. If your pancreas is non functioning, it is functioning but is not producing enough insulin, still you can have diabetes. The first and foremost thing you must do is lessen your consumption of sugary edibles. Don't eat sugar. If you are putting sugar in your hot cup of tea, don't put it. Lessen it to only half a teaspoon or one fourth of a teaspoon, or remove sugar from your life. No, not from your life, but for that specific period of time. Then lose weight naturally. In diabetes, what is the thing that occurs? You lose weight every day. You are losing and losing. You keep on losing weight. For example, if you lose only 3 kilos per day in diabetes, then eat 6 kilos per day. In this situation, you'll lose 3 kgs, but still you'll have 3 kgs in your body. So you won't like go that underweight. You will still have some body mass. Then quit smoking. If you are a smoker, regular smoker, quit it, because smoking is the most injurious disease ever caused. Smoking causes eye cataracts, lung cancer, asthma, stomach diseases, body, and all that thing. Then exercise. Do any exercise, but exercise. Drink water. If you're drinking 3 liters water per day, then lessen it out to 2 liters. This way you will not feel that thirsty. Body Your body will adapt to that condition of drinking 2 liters of water. Then go high fiber. Eat a lot of roughage. Roughage will help your immunity to fight over diabetes. This was some information about diabetes. I hope I hope you found this information helpful. Thank you for listening or seeing this information. It will help you in the future.